Let me ask you this. People are so obsessed about the weight. But when you explain about this body fat percentage, do they understand? I don't want to mention the name, but there are lots of supplement companies, right?
Correct.
Where they do meal replacement shakes.
Yes, yes.
Meal,
It's a huge hit.
it's a huge hit. There are multiple companies like that in the US. I can talk about the companies in the US because nobody cares. It's called Optavia. Optavia. What they do is they just remove the meal and they give you shakes. They give you packet and powders and everything.
Yeah.
I will tell you the situation that I had. Okay, this is an Indian patient who went in the US, who was there for like 15 years, comes to me for abdominal bloating. That is a complaint. And what has happened is that he was pretty big before, and now he has lost close to 30 pounds, which is around like 15 kilos, in a span of a month. Okay, he came with abdominal bloating and abdominal pain. So I said, okay, something is not right. Let's do the blood work. Everything is severely deficient in micronutrients, vitamin D, vitamin B12. Everything was like so low. I mean, I have seen low vitamin D number. This was like the lowest I've ever seen, and the micronutrient as well was very low. I said, okay, so now we'll give supplements and then we'll take it from there. But the worst thing that had happened was I did the endoscopy for him for the pain. I have never seen such a bad stomach ever in my life.
Oh my God.
I have done close to 10,000 endoscopies in my life, in my experience.
Okay.
Such a bad mucositis where the complete lining of the stomach is ripped out.
Oh my God.
It's completely ripped out. I was like, this.
Was it because of him going on this kind of a...
It's because of the lack of micronutrients and the lack of adequate macros through the whole foods meals. So, I'm not sure if this happens for everybody. It is
But
just...
this gentleman who came to you... Oh my God.
This gentleman was... So every kind of like quick fix weight loss, I strongly believe that, there's a problem with it. Busy professionals opt for this quick fix because, when they are busy in between, you could just put a shake, put a water, and then they just drink it. They may lose weight in the short term, but there has to be some kind of compromise in the long term.
Correct. Yeah. It's very distressing to see that, they lose weight in a jiffy, but then there are so many other things that really, I know people whose rheumatoid arthritis got flared up. Okay, or else they ended up having severe hair loss. It even triggered like a autoimmune condition, right? All that has happened. And these are things that we can foresee as professionals.
Yeah, of
right?
course. Of
we
course.
can see. But when we try to get this across, they don't